מדוע המדינה לא דואגת לעדכן נשאים של נגיף ההפטיטיס שעלול לגרום לחשל בכבד, כאשר בדיקה פשוטה וזולה יכולה לגלות את המחלה? כי 80,000 ישראלים הם נשאים של הנגיף, וטיפול מוקדם יכול להציל את חייהם.
In Israel, it's around between, I would say, 60,000 patients to 100,000 patients in Israel with hepatitis C.
HCV is the leading cause for liver cirrhosis, primary liver cancer, and liver transplantation. And in some patients, the disease can be fatal if it's not being treated.
You don't feel it, you don't know it, you don't touch it. It's eating you from the inside.
I was diagnosed by accident because I needed to take pills that affect the liver. And my doctor said, well, we should check for liver disease and your liver condition. And that's how I was diagnosed.
הסכנה היא שמי שלא מטפל במחלה, לא רק שהוא פוגע בעצמו, הוא גם פוגע בקרובים שנמצאים לידו. אתה צריך להתאים את התוכנית של עליית המודעות והסקר לאנשים שהם מאוד מתאימים לטיפול, כי אחרת אתה יוצא מצב שאנשים יודעים שיש להם לקריטריונים של הסל, ועכשיו הם יודעים גם שיש להם נגיף, גם שיש להם מחלה ולא מתאימים לטיפול. זה מצב שמכניס חרדות.
החולים, יש 100,000 איש שמסתובבים בינינו עם פצצה מתקתקת בתוך גופם, ואתם פה ממליצים להסתיר מהם את זה.
There are countries with low prevalence which are planning a comprehensive approach to hepatitis C and B. There are countries with high prevalence that are not really intervening and should be intervening. And then there are countries with mid-level prevalence which are saying that the fact that there's no drugs means that there's a fantastic opportunity to do something new.
Well, the new treatment is a real breakthrough in terms that it gives us opportunity to eradicate the virus and to lower significantly the incidence of mortality and morbidity from hepatitis C.
With the new treatments, we are continuing our life, our normal life, and we have the opportunity to be cured almost 100%.
There's no questions that the treatment is easy, short, and effective.
I was 21 and very athlete when I was diagnosed, so I could have the treatment before I have kids, before I have family, before I risk anybody else except of me.
We were with the Ministry of Health talking about different ideas about screening and some other ideas related to the recommendations of the WHO, but nothing was concrete. So I invited Dr. Bengoa, and he gave us tools, concrete tools, that was the point that permit us to develop a real national plan.
The collaboration contributed enormously in reaching a consensus that a national plan is required for controlling hepatitis C in Israel.
קודם כל אני פתחתי שדולה בכנסת, קבוצת חברים שתומכת בדיון ציבורי בסוגיית ההפטיטיס C, ואני חושב שזה אחד הדברים החשובים, כי בסוף המערכת הבריאות סופגת את כל ההוצאות, ופעולות מניעה הן חשובות כדי לחסוך בהוצאות הבריאות.
When do some of us come into that picture? We just basically reinforce the argumentation that it is useful, when you are well organized like they are, to tackle this in a comprehensive way, in a global way.
We joining forces with many stakeholders, physicians, patient organizations, and key decision makers, we can reach a consensus, a national consensus, and we can reach a point where we can implement a national HCV screening program, and we can also introduce the new antiviral therapy into the countries.
The Ministry of Health recognized this risk factor. They recognized the importance of treatment and the importance of lowering the medical problem or burden in the next years.
2% מהאוכלוסייה הכללית הוא שיעור משמעותי ובעל השלכות רוחביות על מערכת הבריאות לאורך שנים רבות. על רקע מורכב זה, משרד הבריאות נרתם להוביל מאבק מורכב במחלה ובסיבוכיה הקשים בישראל.
The national plan includes 4 steps. The first is prevention of new HCV cases. The second is early detection, mainly by screening. The third is availability, meaning making the antiviral therapy available to all patients. And the fourth is reducing the mortality and morbidity that is related to chronic HCV infection.
The government decided to prioritize the patients who will receive hepatitis C to advance fibrosis, which means F3 and 4 in genotype 1. And this actually included 1/3 of the Israeli basket, which is something that never happened before.
We don't want to wait to get this to this point. We need to avoid it if we can do it. And we have now very good treatments, which is very cost effective, and we should go for it.
If they don't invest now in hepatitis C, the cost of taking care of the consequences of the hepatitis C will be much higher than we can ever imagine.
למעשה, המסלול הלא מובן מאליו של היכולת לזהות את החולים בתמונה ארצית כוללת, להכניסם לתוך מסלול מעקב קבוע, לעקוב אחריהם בצוות רב מקצועי תומך, לשלב את זה עם טיפול תרופתי חדשני מהדור האחרון, צפוי לחסוך למדינת ישראל כספים רבים.
I lead the opposition, but on this issue actually it's an issue that serves all the people in Israel, and we have to work together on finding ways and means of treating as many as possible in order to heal them from this disease.
Now in this year we're trying to extend the indication to other genotypes and other indications like protease inhibitor failures, post-transplantation patients, extrahepatic manifestations, and other indications that we think the government should approve the treatment with interferon-free.
Now it's very easy to fight and to win, and the way is very short now.
The most important thing is to spread the word. Spread the word. Nobody can really understand it until they are in this position.
I think other countries, they have also limitation regarding the budgets of how much do they want to expense on health issues, and they should go for it and try to analyze and have some planning and to consider it with the new treatments of hepatitis C.
If you are controlling the disease, it's because you are doing things in all the possible interventions that you can do. And those countries will be able to control this disease in quite a spectacular way if they follow that logic. You are then controlling the disease. The disease is not controlling you.
We want a world without viral hepatitis.